So suicide is a serious public health concern, resulting in approximately 4,000 deaths annually in Canada. While mental health services are effective in preventing suicide, multifaceted public health approaches complement clinical services and have proven effective in preventing suicide at the population level. Annually, around 200 Manitobans die by suicide. Manitoba has the highest suicide rates of any Canadian province, and suicide is the leading cause of death in Manitoba youth in the between ages 10 and 17. There are also notable inequities. For example, while 1 in 1,000 Manitoba adolescents attempt suicide, 7 in 1,000 First Nations adolescents do so. In response to the high burden of suicide and notable inequities, the province committed to creating a provincially coordinated suicide prevention strategy. And this commitment was reiterated in the 2022 speech from the throne. While this presented a policy window, the suicide prevention file was new to the branch, and a great deal of preliminary work was required in order to deliver on this commitment. So I worked with the HPW policy team to work on 6 different elements: a jurisdictional scan, a data review, a summary of best and wise practices, a provincial inventory of suicide prevention initiatives, and then to define a strategy scope and conduct a gap analysis. The jurisdictional scan reviewed select international, national, provincial, and Indigenous suicide prevention frameworks and strategies. A data review was conducted to understand Manitoba-specific epidemiology using internal government and publicly available sources. Of interest in the data review was identifying regional differences, priority populations who might require targeted prevention approaches, and data sources that could serve as indicators of improvement over time as an aid to evaluating the strategy. And a final purpose of the data review was to identify surveillance gaps that might be addressed as part of the strategy itself. I then reviewed best and wise practices in suicide prevention by consulting grey literature, such as reports from the Mental Health Commission of Canada, Public Health Agency, Centre for Suicide Prevention, World Health Organization, and Thunderbird Partnership Foundation. In addition to the grey literature, a database search was also conducted. To create a provincial inventory of current initiatives, I started with programs I knew, resources I already knew to exist. I also reviewed continuing service agreements with the branch and met with representatives from other government branches and departments, as well as health system stakeholders to learn more about the suicide prevention work that was already underway. Another part of the project was determining scope. At the outset of the project, the health promotion and wellness leadership really stressed that the strategy would need to be feasible and achievable within budgetary and other constraints. Therefore, I engaged in an iterative process with the team and leadership to draft a strategy scope that would balance effectiveness with feasibility. A gap analysis compared best and wise practices with current initiatives and the data. And then further conversations with stakeholders and subject matter experts were conducted to provide insights into what was missing from Manitoba's suicide prevention efforts. Recommendations and calls to action from advocates were also considered, particularly those by the Assembly of Manitoba Chiefs and the Manitoba Advocate for Children and Youth. Once these gaps were identified, some preliminary recommendations were outlined that could fill those gaps. Those recommendations and gaps are confidential to government, are not part of this presentation. But the acceptability and feasibility of the recommendations were assessed by presenting these for feedback to the deputy minister and other leaders. And I have to say that engaging in the gap analysis and scoping exercise was a really valuable experience. As students, we often get stuck in academic or theoretical domains, and the scoping and the gap analysis really forced me and the project team to look at the Manitoba reality in order to create and prioritize truly actionable and situated recommendations while capitalizing on the policy window that was created by the government promise and the coming election. While I don't have time to go through all of the best and wise practices that we came upon, I do want to briefly share two. The first is life promotion. So life promotion is a set of Indigenous-wise practices in suicide prevention based on the First Nations mental wellness continuum framework. White and Mushquash explain that this approach is about honoring cultural practices, recovering Indigenous languages, creating opportunities for intergenerational learning, and recognizing Indigenous people's sacred connection to land and stories are vital in suicide prevention. The Thunderbird Partnership Foundation are leaders in this area, and they have engaged youth to create a life promotion toolkit. So this positive, strength-based approach holds promise in Manitoba, where dispossession, colonization, and inequities in the social determinants of health have created a situation where suicide disproportionately affects First Nations people. Another promising framework is Roots of Hope, and Roots of Hope is championed by the Mental Health Commission of Canada and the Centre for Suicide Prevention, and it outlines 5 pillars that are to inform community-led approaches to suicide prevention. So those 5 priority areas are up on the slide, and then the Mental Health Commission of Canada provides tools and project management support to aid these community-led efforts. They have a community of practice and an annual summit along with consultation services. And so Roots of Hope can be attractive in provincial strategies because it provides a balance between the government leadership, structure, defined goals, and coordination, and then also enabling grassroots community-based approaches that are really critical to suicide prevention. So it could be a good fit for a provincial strategy. Once that work was completed, we began to look at forming a steering committee and determining who might fit on that steering committee, drafting a project charter and selecting milestones, and then completing some preliminary costing. So there are some limitations of this project. First, since risk and protective factors for suicide are wide-ranging and multifaceted, there are a great many possible initiatives that can fall within the umbrella of suicide prevention, and just as much variety in what life promotion might look like. So a different researcher or a different team of civil servants might come up with a somewhat varied approach. Relatedly, a different government with different values, priorities, or spending power may also take a different direction. And it's also possible that my prior knowledge and lived experience led me down a line of reasoning that might differ from another researcher. So while the work was completed in a thorough and somewhat systematic nature, it's a product of a particular time and place. Despite those limitations, this project demonstrates that it is possible to take a population health approach to suicide prevention, as evidenced by the number of governments who have taken this approach and the substantial body of literature on best and wise practices. Those are my references, and here are my image credits, all different Manitoba scenes, and I'd like to thank you for your time and attention today.